Thanks, Claire. I really appreciate the welcome and really great to see everybody here today in this packed room. And obviously to the VAADA team for the hard work in putting on today's event. I'd also like to acknowledge Uncle Tony and his mob, the Wurundjeri people, the Kulin Nation, as traditional owners of this country. Pay respect to them, to elders past and present, and to all First Peoples who are with us today. And it's great to see Aboriginal voices on the agenda for today's program. Also, as is protocol at VAADA, we acknowledge those with a lived and living experience of VAAD. You remain the backbone of our sector. Thank you, Minister Stitt, for turning up today and making time to welcome us to the AOD Service Providers Conference, and also acknowledging the support of the Victorian Government in enabling VAADA to put on today's event. We've got over 300 people that have travelled from across the state to be here, and it wouldn't be possible without the support of the Department of Health. I'm very positive about the work that's currently underway. And in particular, I think the Victorian AOD strategy gives us a direction, and I'm looking forward to also hearing from Deputy Secretary Pam Anders shortly on how this work's unfolding. It's definitely an honour to be here today as VAADA CEO. It's something that I value. It's an amazing organisation, an amazing sector to be part of. And we're sort of, today we're here to sort of launch our new strategic plan, which sort of will take us towards our 50th anniversary. We found a very dodgy photocopy in the VAADA office that sort of, it's a one-pager that sort of has a little bit of history about VAADA. And it's quite an interesting read in terms of some of those discussions that were happening in the early 1980s and late 1970s. In terms of an emerging sector. And it's said that at an interagency conference in March 1980, 55 people were invited to discuss the idea of a peak body for alcohol and other drug services. And at that meeting, it was accepted in principle that an association of government and non-government alcohol and other drug agencies be formed to act as a coordinating and liaison body. And 3 months later, the Victorian Alcohol and Drug Association was born. So we're walking in the footsteps of giants always, people that have fought the hard fights and had the gains over the last 5 decades, and we always need to remind ourselves of that. So our new strategic plan, which is a pretty slick looking document, I think it's on our table out there, so I'd really encourage you to grab a copy and have a read of it. It took us 12 months to finalise it. And I think it just sort of shows the importance that we placed on this piece of work. It began at a VAADA Board Planning Day in May 2025, which saw our board reflect on our performance against the 2021-2025 strategic plan, discuss our current strategic context, and decide on the process, parameters and timelines for developing a new strategic plan. I'm very lucky as VAADA CEO to have a board that is so invested in our sector. They care deeply about you all. The board made decisions about, ultimately the VAADA board makes decisions, is making decisions because they are from the sector. We remain proudly a member-led organisation. The VAADA board authorised the process for developing this plan that allowed us to engage deeply and meaningfully to inform it. We procured the services of consultancy Yoo-Hoo Group to facilitate the engagement and practice and capture a broad range of inputs into an agreed plan. I've seen Ben and Kelly here today, so thank you to Ben Wallace, John Dainton and Kelly Tulk, who were exceptional to work with. They were committed, they were flexible, and they cared about the work. And they had a very big influence in guiding us in developing our final plan for the next 4 years. There are a large number of inputs that helped inform the new strategic plan. Apart from the standard desktop review of existing VAADA documents and data, There was a survey of VAADA members, and we had about 32 respondents from across our organisational membership and probably a couple of individual members. We had 11 key stakeholder interviews, which included the Department of Health and the Commonwealth Department of Health as well, and colleagues right across the country. We had 2 lived and living experience focus group consultations, an AOD clinicians and practitioners focus group consultation. There was consultation with VAADA's Aboriginal Advisory Committee, with VAADA's leadership team. There were 2 staff team workshops. There were 2 VAADA board workshops, including a full day of strategic planning, plus numerous conversations with me. So all of that is reflected in a pretty succinct manner, which saw us really kind of go through a full process of reviewing our values and what our vision is. And I think for me, it gives us clarity, because it's going to be my job as VAADA CEO to deliver on this. It gives us clarity about who we are, what we need to prioritise, and how we're going to hold ourselves to account. So I really thank everybody that contributed to that process, and hopefully you can see yourself in it. I'm particularly proud of the cross-cutting commitments that we've landed on to influence all that we do. Aboriginal self-determination and AOD lived and living experience are not standalone priorities. They're essential to building a system that is equitable, effective, and grounded in the realities of our community. At VAADA, we're continuing to strengthen how we live these commitments, with work continuing to embed them as core practices across our operations and governance. Yeah, as I said, please grab a copy of the strategic plan, because ultimately it's about you, everyone here today. The work that you lead every day, as the Minister said, in communities right across Victoria, keeping people well, safe and connected. You're all the heroes of our sector, and it's our job to give voice, champion and amplify what you do, always advocating for policy, funding and system improvement. And I think you're right, Minister, we can't afford to go backwards. I think, basically be a huge loss to the community for that to happen. All Victorians deserve a quality AOD system of care, when, where and how they want it. And now, in addition to the published strategic plan, we've also produced a short video to introduce it, which I'm a little bit nervous about, but thank you, Tian, for working with Caitlin to produce and direct it. There is a bit of a viewer warning. The people that you're about to see in this video are not paid actors. So be kind. We're all real folks from the AOD sector. But yeah, I really hope you enjoyed today's Service Providers Conference. The agenda's fantastic. To everybody that's made time to contribute to it, this is why I think we're a strong sector, because people are passionate and committed to it. So yeah, enjoy the day and enjoy the video too. Every day across Victoria, AOD services are supporting people, families and communities through complex challenges. But the expertise of this sector is not always seen or heard. VAADA's role is to represent members and make sure their voices shape decisions that matter.
Right now, services are navigating rising demand, workforce pressures and increasing complexity with less funding. The sector needs strong connections, practical support and leadership that brings people together. That's where a strong peak body matters.
The future also needs to be fairer and more inclusive. Aboriginal self-determination must be central to system reform. And people with lived and living experience need to help shape the solutions. Better outcomes come when communities are part of the decisions.
Our strategy focuses on 4 priorities: better access to services, a more connected system of care, a thriving workforce, and strong advocacy for members.
This plan was shaped through consultation with members, partners and stakeholders across the sector. When the sector is strong, communities are stronger too.